Hi, everybody. Welcome. I'm Dr. Ellie Stein, for those of you who don't know me. I've been working as a medical doctor with people with fibromyalgia for about 25 years. I'm recently retired and I'm trying to move everything that I've learned online because at working as a doctor, you only have a license in one province or one state, and it's very hard to help the majority of people. So lots of people with this disease fall between the cracks. I'm sure you're well aware of that. And I'm going to introduce my co-host here, Dr. Yoni Whitten. He has an amazing, diverse background. So although he's a chiropractor, he also has a degree in kinesiology. He's studied widely in things like natural movement, evolutionary health. Some of these I barely know what they mean, so feel free to ask him questions. Nutrition, spinal hygiene, self-care, and human performance. And his online course, the Pain Fix Protocol, is helping people all over the world recover, take note of that word, recover from chronic pain. We've gotten some questions sent ahead, so we have a bit of a feel for maybe some of the things that you might be interested in hearing about. But right now, at any moment, if you have a question, please start entering them in the chat. I'm going to ask Yoni to share the answer to one of the questions that we both received, whether it's actually possible to recover or heal from fibromyalgia.
Yeah, I think it's such a good question, and it's really at the heart of the matter for anybody who's suffering with chronic pain. Is most of the people who've made it into my clinic, they've seen on average 8 to 10 other practitioners with various initials after their name before they get to me. And you're nodding your head, Ellie, because I'm sure it's very similar to your practice.
Absolutely. Yeah.
And so that's really the case with chronic pain. And essentially what you have with a person who's seen that many practitioners is they've been let down time and time and time again and really beaten down. I can't tell you how many people I've met when they come into the practice, and I know them as a personality type and I know their facial expressions that they come in with. And then it hits me, a month or 2 months or 3 months or whatever length of time down the line that we work together. And all of a sudden I see them smile for the first time, or I hear them laugh for the first time. And only then it triggers that, wow, that person that I initially met was not who that person actually is. That wasn't their real personality. That was the impact of however long that they had been in pain and however many different strategies they had tried along the way that had failed them, that had really beaten them into that place. And so the answer is 100% yes. People can absolutely improve their situations. They can get their lives back. They can get back to doing the things that they love. And there are lots of different proven strategies for doing exactly that.
Great, thank you. And I would support what Yoni said. My approach, and we may have time to talk a little bit about our specific approaches. My approach is a combination of really focused self-care, because although we're going to talk a lot today probably about how the brain is really central in fibromyalgia, but you have to look after the whole organism, the brain and the body. So all of the self-care things like getting a good diet, enough sleep, managing stress, pacing activities, all of those things are important. And for me, the new piece that I started learning about 15 years ago was neuroplasticity. Because before I learned about neuroplasticity, people could get somewhat better, but the brain circuits and connections that were kind of keeping the pain and misery going weren't shifting. So I've really found that adding the neuroplasticity piece to everything else that I had already learned and was offering has kind of been the special sauce that's moving people ahead. I don't know,
Absolutely.
Yoni, if you want to say just a little bit at this point about what your approach is.
We can really get into the weeds on my approach. My approach
Yeah.
is, my goal in practice was always to have as many tools in my tool belt as I possibly could, so that regardless of where a person was at, I could give them something to improve their situation. And that's really the root, I think, at the risk of stepping into your arena,
Mhm.
is the root of neuroplasticity, is experiential training in a direction away from the habit that they're currently in. So if they can learn a new normal, then that old pathway has a chance to, basically the body will just reabsorb all of those pain pathways and use them to forge new healthy pathways. And so I just wanted to have a huge tool belt, and that could be, physical medicine, that could be body work, that can be training people with a healthy movement routine, that could be, as you mentioned, sleep, nutrition, supplementation, light exposure. There's so many different ways you can go. So, fibromyalgia is such a big umbrella, and you have people under that umbrella at so many different points along the way. It really requires or necessitates the ability to meet them where they're at and elevate their situation. And once those lights come on, that they feel like, wow, this is different, this has improved, now it opens the door for you to start adding other things that they feel willing, capable, and motivated to incorporate into their routine.
Yeah, I agree. You're really bringing up the point, Yoni, that everyone is so unique and individual. And somebody asked the question of me that they sent ahead, what makes my approach different than maybe some of the other programs out there? And it's really that I'm aware, because I've been a physician for 35 years, that for no disease is there just one way. And
Mm-hmm.
so I think, like you, I think we're both like, we love learning, right? And we love having so many tools in our tool belt.
Mm-hmm.
And it's necessary because not everyone's going to respond to the same approaches.
Well, and that's what I loved, Ellie, about, I know we're not getting to the question, the next question specifically, but I
Mhm.
loved in our first conversation, you mentioned, I forgot the term that you used, but it was a neurological coupling was the idea of what was the smell, what was the sight, what was the
Right.
sound, what were all of these different things associated with the situation that that person is dealing with. You used your own story as an example, and you were so aware of sight, smells, sounds. All of those things were neurologically wired together in your case. And I think that speaks to the individuality of fibromyalgia and chronic pain in general, because for every single person, those sights, sounds, smells, neurological associations are going to be different. And
Right.
therein lies the challenge, right?
And the brain is, I'm just blanking on the word, but it's like distributed. So what we've learned in neuroscience is it's not just like pain is in this area or that area. It's actually spread and
Mhm.
connected to almost every neuron in the entire brain.
Yeah.
So if there's so many ways in,
Yeah.
and you can use all of your senses
Yeah.
as a tool to shift the wiring.
It was like exactly the way that I think of it. And
Yeah.
that's exactly, so you have that pain cycle, and you can interrupt it anywhere along the cycle. And the
Right.
neurological consequences of that interruption are equally valuable no matter where you interrupt it.
So I'm going to look at a couple of the questions here.
Sure.
Stephanie is asking, what have been your success rates?
Really good. Great question. Keep in mind, Stephanie, that my practice was chronic pain oriented in general, not specifically fibromyalgia, although I've worked with hundreds of fibromyalgia patients over the years. My success rate in clinical practice is extraordinarily high. It was somewhere in the 92 to 95% rate in terms of pain reduction and restoring people's ability to participate in activities that they love, and getting their bodies functional again.
Wow. And the second part of the question is it possible that the comorbidities could delay full recovery? So
100%.
yeah.
And
So
I'll
I'll
let
just
you
say
take
the
that one.
common
Yeah.
comorbidities, and this was another question that came in ahead, is kind of this, are ME, myalgic encephalomyelitis, chronic fatigue syndrome, and FM the same thing or not? So I'll tackle that one because that's something I've thought a lot about. They're different but related. And what I'm madly learning about at the moment is some of the common biological underpinnings of many chronic diseases, even things like heart disease, cancer, dementia. All of these chronic diseases at their core have certain um, like poorly functioning nutrient sensors, like the body's just not responding to signals well, often because we're not giving it the right signals. So what makes this science so exciting is if we can give our body the right signals, it can just like miraculously improve in function. So ME and FM are not the same. And the primary difference is that people with ME seem to have a real serious energy problem. Their cells are not making enough ATP. And for some of those people, neuroplastic strategies alone are not sufficient. Whereas in FM, I would say most people can recover. So that's a really important distinction in my mind. I know some people would disagree with me and say that people with ME, that it's really similar and they have equal recovery rates. That's not what I've seen in my practice.
Interesting. I wouldn't have thought of it that way, although your description makes sense. I'm always careful in my practice about putting too much stock into a diagnosis of fibromyalgia. And if this is in no way denying a person's pain, I 100% acknowledge and understand that that person is suffering. But I worry about them putting too much stock in a fibromyalgia diagnosis because essentially the diagnosis doesn't mean anything.
Right.
It's we used to have diagnoses in physiatry of lumbago or cervicalgia. It doesn't mean anything. It means neck pain. It means back pain. Like that, there's diagnoses that are essentially worthless. You say kidney failure, well, that means something. Yeah. So I worry about putting too much stock in a diagnosis like that. Although your distinction does make sense on the comorbidity part.
Yeah.
My underlying position on comorbidities is whatever is in a person's ability to have influence over, they should be working towards lessening the impact of those comorbidities wherever possible.
Yeah, I would agree. There's a question here. I'm wondering if Dr. Whitten can tell us about his experience with brain fog. Does he have any ideas of how to reduce it?
Oh my God, it's such a big question, and I don't think that brain fog is I don't address brain fog in my clinic as a standalone issue. I address it as a component of a much larger problem. So the first thing that I want to know with brain fog is, how is that person sleeping? Second thing I want to know is, what is that person eating? What is their hydration status? I want to know about light exposure. I want to know about their circadian rhythms. I want to know about all of these different things. You typically don't find brain fog in people who have you don't find brain fog in situations where things are functioning the way that they're supposed to. So the rule with a symptom like brain fog is you start tugging on that string and seeing what in that person's current lifestyle, habit, situation is suboptimal. And then you work closely with that person to say, what are you willing to change? What if I can show you the research showing that if you can get half an hour or an hour more sleep every night, and there's a lot of different ways that we can approach how that occurs, brain fog diminishes by a certain amount. What if I show you that by having certain nutrients tested, there's a direct correlation between brain function? Are you willing to get those blood tests and then subsequently make nutritional modifications to bring those nutrient levels up? Hydration status and brain fog so closely tied. Are you willing to monitor the color of your urine for a few days so that we can get a rough indicator of what your hydration status is. I want to know about physical activity levels. We know for a fact that physical activity directly ties to ability to focus and concentration levels. So, and also can influence neurological wiring in the brain like super, super fast. So I want to know about all of these things. And I find that when you start tugging on that string, typically it's not going to be one thing that you find. It's going to be a series of things that you find. And then the key is not to overwhelm the person, but to say, hey,
by doing these 17 things at once.
That's right. Let's try this one thing and let's see how it influences this one thing that you're having an issue with. And then, hey, if that goes well and you're concentrating a little bit easier and you're not getting that spacey feeling and you're recalling your thoughts and your memories a little bit better, hey, would you be willing to do this other, hopefully very easy to incorporate thing that might move the needle a little more for you? And that's really, whether it's brain fog or whether it's energy levels or whether it's pain levels, that's really going to be the approach to a lot of it with these pain conditions that don't fit neatly into any box. And it's a thing that's hard for me because I just don't put a lot of stock in a fibromyalgia diagnosis. So really what I want to find out is what else is happening in that person's life.
So maybe to paraphrase what I think you're saying, Yoni, is you're taking a functional approach rather than a diagnosis approach. You're like, what is not functioning optimally and how can we fix it?
That's exactly right. You know, a fibromyalgia diagnosis for me is no different than a cervicalgia diagnosis. The person has neck pain. Okay, well, now it's up to me to figure out where is the neck pain? Yes, why? That's what we need to know. Why does that person have brain fog? Why do they have widespread pain and fatigue? Why are they having sleeping difficulties? Why is it so closely tied to anxiety and depression and all these other things?
I'm just thinking of a book I just read by a psychiatrist, Christopher Palmer, and he's bringing in the hypothesis that metabolism, meaning, the bad food that we eat, basically, is causing all mental illness. And he's a pretty legitimate, I think he's at Harvard or something. So, I'm taking quite seriously what he has to say. And it's kind of, I read another statistic, it's like 86 or 93% of North Americans have poor metabolic status.
Yeah, it's just wild, Ellie. I saw a report that just came out that shows that it's somewhere around 60% of the North American diet comes from ultra processed foods.
Wow.
I mean, this is brand new data coming out. 60% of the diet. I mean,
I don't.
Imagine you went to the I'm sorry, I'm about to use the Spanish word. Imagine you went to the gas station and you've got a regular fuel tank and you fill 60% of your tank with diesel fuel, just a fuel that your engine is never designed to work with. Are you going to be surprised when you're broken down on the side of the road and it's not working? It's funny to me that these things that are so common sense, that science is finally catching up with them and legitimizing, ideas that are just like, it would be hard to defend a position that was otherwise.
Yeah. I think we're on the same page yet again. So there's a question here from Victoria. Have vitamin deficiencies been proven to cause or contribute to chronic pain, such as FM? So I'm sure, Yoni, you're nodding. You've got some things to say about that. I'll just say, yes, I think in keeping with this general sense that most people are actually not taking in enough of the nutrition that our bodies need to function. There's, I'm aware of some studies that are definitely showing there's deficiencies.
Yes, 100%.
Want to add to that?
I actually just prepared a big presentation on nutrient deficiencies, specific nutrient deficiencies in chronic pain conditions, not FM specific. So I will preface that. But I have seen very bizarre, or rather case reports of very bizarre pain conditions that were impossible to diagnose, where a person was seeing 20, 25 practitioners. Ultimately, they ended up at the Mayo Clinic, and it all came down to a vitamin D deficiency. Gotta check for vitamin D. That's like standard. Anybody with hard to diagnose chronic pain condition, gotta check vitamin D, especially if you're up in your neck of the woods, Ellie, because if we were betting, I would be betting on vitamin D deficiency pretty much for everybody up there. Because it's rampant even in the southern states in the United States, and we're getting way more sun than you guys are, but still the rates for vitamin D deficiency are astronomical. Magnesium, potassium, super common deficiencies, directly linked to bizarre pain conditions with muscle pain, joint pain, nerve pain with certain vitamin B deficiencies. There are very specific blood tests for all of these. And the general blood test, and this is an important point and one that I really pound in the presentation that I give, is which tests people need to get in order to really find out. So like with magnesium deficiency, for example, the standard blood test just doesn't show, because a person can have normal magnesium on the test, but that's only testing your serum magnesium. It doesn't show what's actually in your cells. And there's another test that is a little bit harder to find that can give a much more accurate representation. Likewise with vitamin D, there's a specific test that people need to get. And so I don't provide these tests. I don't sell these tests. I just want people to have the right information. So that presentation will be coming out soon. But yes, absolutely, nutrient deficiencies can contribute to bizarre pain conditions. Lots of case reports, lots of information on that.
So there's kind of a follow-up question on, say, an anti-inflammatory diet or eating style. And I would say I'm actually just working on a blog post right now that's going to come out on my webpage in April on something called the autoimmune protocol. So there's growing evidence that certain foods really annoy the immune system and are more likely to cause inflammation than, say, other foods. And there's a lot of overlap between that and this kind of horrible standard North American diet that Yoni and I were just talking about. You know, things like refined wheat, too much sugar, ultra processed food, drinking calories. That's like a bad idea. So I think there are some basic principles that can really help improve all of the nutrient sensors, which then go on to improve health in general.
100%, 100%. And I would tack on to that when you're improving health in general, it goes back to that question that we had at the beginning, which is how much do comorbidities contribute to this? If we can reduce the comorbidities by making the person healthier in general, you're setting them up for success with resolving brain fog, fatigue, chronic pain, all of these different things. It's like setting up the dominoes and then, you know, just kind of letting it run.
A couple people are asking, do you recommend any particular supplements?
There's certain supplements that like everyone should be taking, just because, you know, the North American diet is what it is. EPA and DHA, which are essential fatty acids, omega-3s. Those are something that the deficiency is so widespread. The North American diet is so heavy on pro-inflammatory omega-6s, which are things, they only become harmful when they get way out of balance with the omega-3s. So the ratio between the two is important. What we're seeing with hunter-gatherer tribes is they have a ratio of somewhere between 1-to-1 and 2-to-1 of omega-6 to omega-3. And what we see in, you know, North American diets is somewhere like 20-to-1. And so we do need to bring that ratio back into balance. And it has anti-inflammatory effects. It has anti-pain effects. It has improved cognition for the who was asking about brain function. That one's a biggie. Vitamin D3, definitely if you're in you know, an area that doesn't get a lot of sun, or areas where you're indoors for basically, if you're not living on the equator, you should probably be taking vitamin D3. And even if you are on the equator and you're not spending much time outside, we just don't spend enough of time outside as a culture anymore. So D3, omega-3s, and probably some probiotic, prebiotic. Those are things that I think are safe recommendations across the board for everyone. Also, very limited data on harmful or adverse effects from taking those supplements, as long as you're within ranges. One thing that I would say is, if you're going to supplement with D3, please get an accurate test before you start supplementing, so that you know how much to supplement with, and then you know when you can back off to a maintenance dose when your levels get back to where they need to be, or you know that, hey, I need to push these up a little bit more, or I need to consider investing in a higher quality supplement to make sure that my body is really absorbing this nutrient. But either way, you need to monitor those levels, because fat soluble vitamins are not something that we toy with and just throwing those in, you know, like we would a water soluble vitamin, where any excess just gets peed out. So get your levels tested if you're gonna get serious about your vitamin D supplementation, which I do think is worthwhile for anybody suffering with chronic pain.
So there's a little bit of a discussion in the chat, and it's maybe a great opportunity to talk about I just want to support what you just said, Yoni, about work with a qualified healthcare professional, right? DIY, when it comes to things like drugs and supplements, isn't always the best way to go.
Yeah, well, certainly it depends on what you're incorporating, right? So like with omega-3s, if you're within the range that is kind of like a standard recommendation, then you should be, you know, no problem there. Just make sure you get a high quality supplement. High quality when it comes to omega-3 means you're getting a triglyceride based omega-3. You don't need to go with the super expensive forms or the krill oil. This is really good news. A triglyceride based fish oil, high in omega-3, EPA and DHA. Make sure that it's small fish, anchovies, sardines, because the larger the fish, the longer the lifespan, the more they've been exposed to toxins in the ocean, the more of those toxins are in the end result. So you get small fish, mackerel, anchovies, sardines are what we're really looking for there. Triglyceride based, that's the way to go. And then yeah, so with the vitamin D, there are some unique options that are coming out now, and even some sources that are unusual. So some cool things that are coming out.
I'll just add to your comment about krill. So some of you know I went to the Antarctic just over a year ago, and the biologists in the Antarctic are up in arms because krill is the basis of the ecosystem, and countries are fishing out the krill. So I actually tell people, please don't use krill oil, you use fish oil. There's a testing center in Guelph, Ontario, Canada that tests fish oil for purity. So does it have PCBs and mercury contaminating it or not? So I would say, if you're going to take a fish oil supplement, take one that has the testing logo on the outside, so that you know that you're not just toxing yourself with more bad things.
Yes. Yeah. You don't need to go super expensive on the fish oil, but 100% to your point, you do get what you pay for, because you also don't want to go super cheap, because you can get some of those toxins in there. And the last thing that you want to be doing is poisoning yourself with the PCBs and the mercury, like you mentioned.
So I'll just say, Suzanne has mentioned, which I was going to bring up before, in Canada, you actually can't get vitamin D tested anymore unless you have kidney failure. The government has decided that because we're all deficient, it's a waste of time to test, and everyone should just take vitamin D.
Wow. That's shocking.
I know, it's been that way for a few years. So I'll just say, there is a lab, and of course there's many private labs in the US where you can pay to get your vitamin D tested. And one that I'd recommend is Omega Quant. And it's where you can also measure the ratio that Yoni was talking about of omega-3 to omega-6. The guy who runs it, Bill Harris, is, super credible. He's like the guy who's been doing all the research on omega-3 for decades. And the prices are very reasonable. So they're offering a very high quality test for a reasonable price. And they also test vitamin D. Think, if I remember correctly, I think it was $49 for the vitamin D part of the test.
Yeah, very good. I've worked with that company as well, and I can second your recommendation. I do think it's worthwhile to have a baseline so that you know what your levels those should be, because again, like we were talking about earlier, under that umbrella, we need to work with, personalized. What's the person's, how much time are they spending outdoors? How much melanin do they have in their skin?
Right.
Typically what we see is the darker the skin tone, the greater the levels of deficiency across populations.
So omega quant, so omega, like alpha omega, OMEGA, and quant, QUANT. I'm just going to go to a couple questions that came in because they also allow us to kind of explain a little bit more what FM is. So one question that came in, I think, to Yoni was, is intolerance to vibrations related to fibromyalgia? And what I would say about that is the new definition of, I won't say the new definition of fibromyalgia, but the new categorization of types of chronic pain. There's a category that came out, it's now 8 years ago in 2016, and it's called Nociplastic pain. So it combines the word noci, which comes from noxious, meaning unpleasant and uncomfortable, and plastic, meaning neuroplastic. So it basically means pain that's being generated by neuroplasticity in the brain. And fibromyalgia is like the poster child for this type of pain. And what makes it different than, say, acute pain is that in addition to pain all over, which is the cardinal symptom of FM, you also have all of these other symptoms that are caused by the brain. And so things like poor sleep, brain fog that's been mentioned, and sensitivities in every sense. So sensitivity to light, to sound, to taste, to touch, and to vibration are all really common whenever the brain has gotten into this kind of, the danger alarm system has gotten stuck on, and the brain is hypersensitive to everything. That's when you get these additional symptoms. So to that, whoever asked that question, I'd say, yes, all these kind of sensitivities are really common in FM.
Yeah, very, very well said. I remember a case that was presented in some of my postgraduate training where they had somebody with such a severe central sensitization that the only way, the final resolution after this person had seen, geez, God knows how many practitioners and tried how many different strategies, was a full body cast for a period of time to desensitize everything. But you can understand as a practitioner neurologically how that makes sense. It's like a sensory deprivation tank. We're gonna remove everything.
That sounds pretty harsh. I mean, the side effects of that lack of movement.
It is.
Are kind of horrifying.
We can't forget also that lack of movement is also a stimulation of pain.
Exactly.
So, I don't remember how long they stayed in the full body cast. It wasn't a super extended period of time, but they needed something. I wonder if a float tank would have sufficed.
Yeah.
Yeah, but the idea, as you said earlier, there are a lot of different ways to play with it once you understand, the mechanism. And so I actually have a good question that kind of piggybacks onto that idea.
Okay.
It's and maybe you want to jump in on this one, Ellie. Is everybody in agreement?
Yes.
Which we could say no right off the bat.
True, yeah.
but let me finish here before we unpack it a little bit more. Is everybody in agreement that fibromyalgia is related to central nervous system sensitization?
So that is such a great question. So 25 years ago, when I was just getting into the field, everybody knew that FM was due to metabolic problems in the muscles. And there was a bunch of studies out showing the muscles aren't making enough energy, and that's why people have pain. And no one had even considered the possibility at that time that the brain was involved. So we were saying it was peripheral, right? Outside the brain and central nervous system. Then all this research on neuroplasticity came out, and the International Association for the Study of Pain created this new category, especially for fibromyalgia, called nociplastic. And now everybody knows that it's 100% a brain problem. But there's this little niggling problem with that, which is which a question also came in on, which is there is evidence in about half of people with fibromyalgia of small fiber neuropathy. So if you do a skin biopsy, you can actually see that the little sensory nerves are kind of dying. There's not the normal number and structure of nerves there. So what I would say is I think it's never one or the other. It's always both, because you can't have a problem in your brain not affect your body, and you can't have a problem in your body not affect your brain.
So
So I
well
don't know
put.
what your take would be.
I love how you finished that, and my take would be that the problem is the way that we've thought about it for so long, with this separation between body and mind, and really it's how do you separate them? Where does that separation occur? You know, the original separations came from anatomists, which were, let's face it, they were a weird bunch of people. They were breaking, like, because when the first ones came out, it was illegal to handle dead bodies. So they were breaking into morgues and dissecting these dead people under candlelight. It's I find that stuff absolutely fascinating. The history of anatomy, not the breaking into morgues part. But these were very strange people. You know, they made separations between cervical spine, thoracic spine, lumbar spine, because the vertebrae look different if you go to the top and the bottom and the middle. But the transitional segments, the body's amazing. It's one spine that all works together to accomplish one task. Many tasks, but the same thing between the central nervous system and the peripheral nervous system. They feed each other. You know, it's one doesn't do you much good without the other. You know, brain and body, well, they feed each other. You know, the brain relies on the body to provide all of the input. The body relies on the brain to provide, you know, most of the output. But we're finding more and more that much of the output comes from the body as well. Is one more valuable than the other? No, they're all part of the same system.
Yeah, I couldn't agree more. And there was a question in the chat about kind of probiotics and prebiotics, which allows me to just bring in, and it's not only our body, it's the like 100 trillion bacteria that live in our gut that produce invaluable molecules that are part of our health. So when we eat ultra processed food, we starve them. They literally die. The good guys that we need to keep us healthy die, and the bad guys overgrow. That's called dysbiosis. And it's just yet another way in which, and those bacteria make things that, where do they go? They go throughout the entire body, including the brain. And there's tons of studies now that there's changes in the microbiome related to mental health, right? Yeah. And this is all pretty new, like in the last 20 years. Before that, nobody thought what you ate had any impact on mental health. I'm a psychiatrist, so I can tell you nobody thinks about that at all in psychiatry.
And you're right on, and it brings it full circle to two things that we've already talked about with the brain fog and the comorbidities. Like, how are you supposed to take this person and get them out of pain? How are you supposed to take them and get them out of this brain fog situation if they've got that going on in their intestines?
Right.
Yeah.
So it's always everything. You got to look at everything.
Yes. And
not all at the same time, but
yeah. So the art of it is how to introduce it in a sustainable way to allow the patient to win.
Yeah.
There's
another question in the chat, which we might both want to take a stab at. So would pacing strategies, which are proven to help ME/CFS, also apply to FM and chronic pain? So my take is absolutely. I have in my manual, Let Your Light Shine Through, I have a graph in there that came actually from my local chronic pain clinic, where they say, you know, you want to increase activity, but you don't want to increase your pain by more than 2 out of 10, because that's going to be mentally discouraging. And now physically, you're going to have a recovery time, which is going to be counterproductive. So I talk a lot about baby steps to continually try to do what Yoni's recommending, like continually try to figure out new strategies, continually try to open up new possibilities, push your boundaries, but do it in a careful, small way so that if you have a setback, it's a minor one that you can quickly overcome.
So well said. The image that's in my mind, Ellie, is like you're walking up a hill and there's a peak. You don't know what's on the other side of it. Yeah, it's scary because you don't know what's on the other side of it. So every day you want to kind of get up to that peak and you want to get as close as you can to being able to peek over the other side. But you're going to hold yourself back no matter how good you feel, because my rule is I love that 2 out of 10. I had never structured it that way, although it's in my mind. Like I had never gone all the way to explaining it. But one of the things that I always want is I want the person to win. And so my vision of that is I want them to stop before they're tired. So there's a concept, it was introduced by a guy named Paul Chek 25 years ago, probably. And the idea is working in versus working out. And this is a critical point for people who are suffering with chronic pain or fibromyalgia. The concept of working in, and many people on this call might be familiar with it, is more of a yoga Tai Chi concept where you're exercising, but you have more energy at the end of the session than you did going in, as opposed to working out where you've just sweated like crazy, you're drenched, you're exhausted, you're breathing heavy, you have way less energy than you did going in. A person with chronic pain or fibromyalgia cannot work out. It is a recipe for disaster. A person with fibromyalgia and chronic pain absolutely must work in. They have to find, so one of my non-negotiables for people with chronic pain or fibromyalgia is having a daily movement practice in whatever form that takes. That might be a person lying in their bed and doing some gentle wrist or finger exercises, but movement, the neurological input of body movement is the counterpoint to nociception. It's the direct one-to-one counterpoint. And we know this from hundreds of thousands of studies that are the more we can get movement stimulus to go up, the more we can reduce nociception. So they're on this teeter-totter, and that's why it's gotta be a non-negotiable. We have to find some level that allows that person to be successful. It might be walking from the kitchen to the living room.
Right.
But
yeah, I couldn't agree more about setting yourself up for success and not getting, we call it the push crash cycle. That's what you don't want to be in.
And it's crazy, right? I just got a message from somebody who's the standards that we hold ourselves to. Oh, before I had such and such accident or before this happened to me, I was running 5 miles a day. And now I can't run 5 miles a day. I understand that, but we need to find something that you can do,
right?
So that we can slowly retrain your body back to the point that you were at prior to this thing. And the answer to the question is always whatever it takes. There's a quote that I love, however long it takes. And there's so many variables to work with. That person was so focused on the mileage that they were running, but there's time, there's frequency, there's volume, there's all of these different elements of movement that we can play with to set a person up for success. And it's very hard if you're managing those elements properly to not find something that can work for everyone. And then you just slowly build on it.
I think I'm going to address maybe 1 or 2 questions, and then as we finish, Yoni, turn it over to you, because I think you told me earlier you wanted to share a few specific strategies with people.
Yeah, I would like to give an overview of kind of, I touched on one there, which is a daily movement practice. That's one of my non-negotiables, but there are a few others that I'd like people to at least have awareness of.
So the 2 questions I want to take from the chat, maybe one is for you because I don't have as much experience with it. So what is the correlation between fibro and osteoarthritis, and how can people work, move ahead when they have both of these problems?
Mhm.
That's a
Yeah,
common question I get.
yeah, I can see that the populations that are affected by both of those conditions have a tremendous amount of overlap.
Mhm.
The way that we work with osteoarthritis does have quite a bit of overlap of how I work with fibromyalgia. I've never even thought about it, but the way to work with osteoarthritis is the number one thing, restore proper structure and proper function.
Okay.
So how does that manifest? If you're dealing with osteoarthritis of the spine, you need to restore normal curvature in the spine and a normal upright posture. You know, what we're seeing across the board in population, starting at a very young age, at this point, 70% of the population has overt signs of structural dysfunction in their spine. And this is due to several things that are typical in our modern lifestyle: an abundance of time looking down at devices, head down position. The more the head angles downward, the heavier the head becomes. So when you get into a 60-degree down angle, you can take a 10-pound head and it now weighs 60 pounds. And then you extend that by however many minutes or hours the person is spending in that position. And then you couple that in a disastrous way with a lack of general physical activity, where you have less strong bones, less strong muscles, less strong connective tissue to hold the body up. You got a heavier head in a worse position, and you have less strength to hold it up. You add the final bowling ball onto this, which is 60% of the nutrition that people are getting nowadays is coming from ultra processed foods, which frankly doesn't have very much nutrition. And, you know, our body's cells can only be made of whatever nutrients we put in, you know? So it's really kind of a disastrous triad there. The good news is it can be fixed. The body cells constantly turn over. You start putting in good materials, the body can make better and a better end product. You start increasing physical activity, your body will become stronger. This is proven laws, the same as gravity. You can actually train the curves back into your spine. You can restore proper position to your shoulder joint, and you can really alter the way the joint tissue responds as a result of the shoulder being properly centrated or the hip being properly centrated. So it is, depending on where that person is, we've talked about the spectrum of fibromyalgia. There's also a spectrum of osteoarthritis. It's graded, you know, 1 to 4. So depending on where that person is in the spectrum, you can always improve. And that's what I love about it. And so we would work, number one, to restore proper structure and function. There's also quite a bit that you can do nutritionally, diet, and specific supplements for osteoarthritis, and to some degree for fibromyalgia as well.
Okay. The other question that I saw somewhere in the chat that we may both want to address is, how long does all this take?
Ooh,
and so what I'll say, I have a little slide that I often show. In the neuroplasticity space, people often talk about kind of go hard with your daily practice for 6 months, and you should see some pretty significant improvements. And what I'll add to that is, sometimes it happens much, much faster. So just a personal story, I had very severe multiple chemical sensitivity my entire life, and it basically went away or got 80% better within a week.
wow.
So if you really get the message to your brain that this pain is not a sign of tissue damage, it's not a sign of danger, it's just is a bad word. Instead, it's a habit that the brain has gotten into and has hardwired. It's surprisingly fast sometimes to just reverse those beliefs and the actual neural pathways. I've had many people have significant improvement in say a month.
Mm-hmm.
I don't promise that because everybody's different, but it can be pretty significant, pretty fast.
And I love what you said there, Ellie, about the pain habit.
Right.
It's so true. And one thing that I think people on the call will resonate with is when you think about it in those terms, like the same way that we think of a person who has a habit of drinking alcohol or a habit of smoking cigarettes. It's extraordinarily difficult. And I think research has finally caught up. This is another thing where research has finally caught up to the practices that we've seen over the last 20 years really be effective for these things, is that stopping a habit like that in a vacuum is extraordinarily difficult, but replacing that habit with something else, when you have the sensation, when you're in your environment, when you're exposed to the triggers that would lead you to reach for that drink or reach for that cigarette, you make the conscious shift. And I know that this is terminology that you use in your programs, and you specifically to go to something else. You're literally growing new wires from your brain to your body that create this new pathway that requires conscious effort in the beginning, in the same way that learning to drive a stick shift requires conscious effort in the beginning. And eventually you do it enough that it just becomes automatic. You don't have to think about turn signal, clutch, shift knob, all of these things. Everybody can relate to that. But just putting it into the context of pain and understanding that pain is a habit, I think is a really powerful reminder. And the one thing that I would want to add to that is how much time it takes. The formula that I've seen is how ingrained the habit is, how much those tentacles have extended into different areas of that person's life. And then, of course, the main thing is the person's ability to jump in with both feet and really, I want to, the word vulnerable is coming to me, because oftentimes people are so guarded, and it's a natural reaction for human beings when you've been kicked and beaten and practitioners that you've worked with have failed you. You go into this guarding, protected mode, and you're unwilling to try. And I think the person's willingness to, if you're not, you have to be willing to try something new to get to a new place.
Yeah, I couldn't agree more. We've just got a few minutes left, and I'd love to turn it over to you at this point, just to kind of share your overview.
Sure. Yeah. I did some thinking in preparation for this conversation. Like I said, I enjoyed our last conversation so much, and the way that you think about it in so many ways overlaps the way that I think about fibromyalgia. And you also brought these really interesting different views of things that I had been seeing, but you seeing it in a slightly different way made me think about it a little differently. And so I really enjoyed that. And what I wanted to do is create some kind of overarching structure for the things that, to my mind, are just non-negotiable, that anybody with fibromyalgia, anybody with a hard to diagnose chronic pain that doesn't fit neatly into those boxes, these are things that people should, for their own best interests, find a way to incorporate into their lives. Okay. We've touched on some of these already. Nutrient testing, especially vitamin D. I'm going to have to share that case study with you about this woman at the Mayo Clinic, because it's a fascinating. She saw so many different practitioners, and to your point on the last question, I believe that her wild symptoms. I mean, she had on her symptom form, Ellie, I didn't mention this earlier. It was like 4.5 pages long of the symptoms that she was having. So you can imagine this woman and everything that she had gone through. But she had a remarkable turnaround. I believe the time frame was 3 months. And you're talking about extraordinary pain. And I've never personally had a symptom sheet go 4.5 pages. So certainly a very challenging case with a remarkable turn of events, simply from supplementing with vitamin D and getting her levels back to normal in 3 months. So testing for nutrient deficiencies, I think, is very much worthwhile for people with hard to diagnose chronic pain. To the point that you made a minute ago about overlaps between osteoporosis and fibromyalgia, one thing that I always come back to is this great quote that was presented at the International Fibromyalgia Conference, which is: the major portion of head, neck, jaw, and shoulder pain experienced by many fibromyalgia and chronic fatigue and immunodeficiency syndrome patients was attributed to the head and neck posture of the sufferer. So this one for me is a non-negotiable because it's right in my wheelhouse, and the rules for fixing these things are the same as the rules for exercise, which is when it's done at an appropriate level, it works across the board. In other words, if that person has a head and neck position that is not normal, it needs to be restored to normal. And the reason makes perfect sense when you understand it. Head becomes heavier the further it pushes out in front of the body. That means it becomes lighter the further it goes back. That means that you are approximating the idea of the full body cast that I mentioned earlier. The person is getting a ton of overload. The body is in panic mode. It feels like you're going to fall on your face. It starts protecting itself. It requires way more muscular activation, way more muscular effort, which contributes to pain, discomfort, a massive energy expenditure, chronic fatigue, robbing resources.
And everyone gets like
huge. The pain here, overgrowth of these muscles. You get muscles here in oftentimes really small people who look like bodybuilders in their necks. And no matter how much massage you do, it'll never go away because it's related to head position. This is stuff that I did every day in clinical practice just for years, is just fixing head and neck position. So you're offloading this tremendous burden from the person. And the coolest thing about it, Ellie, is it pays dividends 24 hours a day, 7 days a week, whether you're awake or you're asleep. It is calming down your system and removing that burden. That's why, for me, it's a non-negotiable. It's like,
I'm sitting up straighter.
That's it. Yeah. And it starts with awareness, the same thing as neuroplasticity. And there is neuroplasticity built into this because as you experience greater comfort, and the comfort really starts out with greater functionality, like the person who's here and has these really overdeveloped muscles, they have a really tough time turning their head because the muscles are so tight and the joints in the neck are literally no longer in alignment where they can move properly. So you just get that back to where, and it's neuroplasticity built in because every time they go to turn their head, there's this new awareness like, oh, that was easier than it used to be. Oh, that didn't hurt anymore. Boom, it's built-in neuroplasticity every time they move, which again is the main reason I wanted to talk to you, because I'm saying like, oh my God, I'm doing neuroplasticity without ever having to set out doing neuroplasticity. And that's the reason why the things that I'd done in practice worked. And I was doing those things before I even knew about neuroplasticity. So it was like, oh my God, I understand it when it came in. So that one is a non-negotiable for me. Nutrient testing is a non-negotiable. You mentioned one early on in this, and we really haven't had time to dive into it. Sleep.
Oh yeah.
Practice. It's just huge. I would want any chronic pain sufferer, anybody with fibromyalgia, to think about sleep the same way that a professional athlete thinks about training for their sport. It is that important. We've got research showing that one night of bad sleep dramatically increases a person's pain sensitivity and their felt pain. The coolest thing about this, and you know this, Ellie, because you're shaking your head, is the reverse of that is also true. So you can take a person where nothing in their life has changed except their sleep, and their pain levels go down and their sensitivity to touch goes down after one really good night of sleep. Now you imagine what happens when you stack up a bunch of good nights of sleep, and it just sets these people up for success. Understanding the science of sleep and all the factors that go into that, absolutely huge, easy to do. Many of these things are super easy to incorporate, not expensive, lots of bang for the buck on that one.
Okay, that's great. Thank you.
Yeah. Other ones, non-negotiables, daily light exposure, especially in the morning. Tons of research on this. We've got a study that shows that 6 days of this type of light exposure produce the same impact on the Fibromyalgia Impact Questionnaire as cognitive behavioral therapy. 6 days of light exposure. And in a longer term study that went on for 4 weeks, the results of doing morning light exposure, this is bright white light exposure first thing in the morning, were comparable to the reports of incorporating physical exercise programs in terms of the reduction on the Fibromyalgia Impact Questionnaire. And what that takes into account for the people who are not aware is pain intensity, how much pain interferes with your activities of daily living, symptoms of depression, amount of sleep disturbance and physical functionality. One of the worst things about these people for people suffering with chronic pain is they can't do the things that they want to do. I've heard it so many times that people feel like they're living in a cage. These things are just absolutely non-negotiables. And then, as you mentioned earlier, the secret sauce, when you add in neuroplasticity and the awareness and the conscious shifting into this, I think you turbocharge the results of all of these things. I just think it makes everything else that you're doing so much more powerful. And that's the reason I love what you do.
Well, thank you so much. And I'll just maybe put the cherry on top of that. I've been doing a lot of reading about research in mindset. So I want to leave everyone with like the clear consensus between us that there's absolutely hope, that these things really do make a difference. And if you have hope, if you believe us, and not all of you will, right? Because you've been suffering for years or decades, and some of you might be like, yeah, not sure. But if you can just be open to the possibility that fibromyalgia can, like people with FM can recover, it's going to make it more likely to happen. And I know that sounds a little bit woo-woo, and I've got a whole talk on my website just on mindset, and it's incredibly powerful. So I'd invite you, it's free, and I'd invite you to watch it.
And I would tack on to that, Ellie, that they don't even have to believe us, because I've got research, and I'm happy to share this research with everyone so that they can see the results of what can be achieved when you incorporate these strategies into your life. And so then it's just a matter of finding somebody whose approach you like, who can help you incorporate these strategies in a way that works for you and sets the person up for success.
Great. I think that's a great time to stop there, because we want to respect people's time. Thank you to everybody who joined us today. It has been recorded. I know I'm going to be posting it on my website and on my YouTube channel. I don't know, Yoni, if you're going to be posting as well.
I'd love to. Yeah.
Okay. That would be great. So we'll both be posting, so you'll get a chance to look at it. Or if you missed it today, you were busy, you can go back and look at it later. Thanks very much, everybody.
Thank you for being here.
Bye-bye.